Hi there, my name is Serena Armstrong, and I'm currently a practical nursing student at Portage College to become a licensed practical nurse, or LPN. Today, I want to discuss a value I believe is integral to the nursing practice, as well as my personal strengths and weaknesses regarding the Canadian Council for Practical Nurse Regulators, or CCPNR Requisite Skills and Abilities, or RSAs. The value I chose to showcase is that of responsibility regarding nursing values and ethics. ASL et al. In 2024 intertwines personal characteristics of reliability, dependability, and moral distinguishability in the definition of responsibility. They outline that the ability to assess patients and administer treatments will depend on the nurse's personal responsibility to perform these tasks to the highest of standards. ASL et al. Also highlights that responsible nursing gains the trust of patients and colleagues and keeps people safe. The value of responsibility is so pertinent to the nursing practice that in 2023, Grace et al. Used the professional responsibility nurses have to both the individual and society as the framework for decision-making strategies in the face of a conscious objection, something that can occur in any type of nursing practice and something I will most likely experience. I believe I bring quite a few strengths that are recognized by the CCPNR to the nursing profession, including strength in the physical and environmental aspects of RSAs. However, I believe my biggest asset is my cognitive ability. I am able to perform consistently at a high level due to my background and education in animal research. I was head technician at a $14 million Holstein research facility where I had to utilize all of the skills outlined by the CCPNR's definition of a cognitive RSA. Specifically, I had to remember pertinent information about individual animals, the trials being conducted, and be able to manage that information so that time-sensitive research trials were conducted with accuracy and precision. I also had to multitask and prioritize certain activities such as regular animal feeding, milking, and sample collection, so all those tasks were completed. Within that framework, I still had to be able to utilize my critical thinking skills to troubleshoot equipment or animal breakdowns and animals who did not always cooperate, and make critical decisions regarding my day-to-day operations. I also had to utilize my applied math skills to measure and collect accurate and precise rumen fluid, milk, blood, urine, fecal, feed, and other various samples for analysis, and then perform said analysis to the best of my abilities. If I had to pick one weakness in the CCPNR RSA list, it would be my interpersonal ability. Although I'm affable by nature, I sometimes struggle to see others' perspectives, particularly when they are vastly different from my own. An example of this would be when doing school group work, such as a group paper for nursing school. I can struggle to work in proximity with others and accommodate their different experiences or academic strategies. I believe growth in this area is really important, as I will be working with a multitude of other health professionals in my career. So all is not lost. Utilizing the College of Licensed Practical Nurses of Alberta, or CLPNA Continuous Competence Program Framework, can help me turn my weaknesses into a strength. I would first have to participate in a self-assessment. The CLPNA gives the LPN a scale in which they can rate themselves. So after rating myself in the requires improvement category, based on my knowledge, skills, and judgments by asking myself if I possess the qualities in the interpersonal RSA category, I then will be able to construct a learning plan, which is essentially a plan to guide myself as an LPN in the learning I plan to complete. The Continuing Competence Learning Guide has resources to support my learning, including specific learning modules and videos in relation to interpersonal skills. One of the specific videos I could utilize is the Collaborative Practice in Nursing, because it specifically targets enhanced learning and taking people's personal needs and considerations into account and putting people at the center of my care, which is something I identified I need to work on. The video outlines respectful communication, how individual and shared knowledge enhances patient outcomes, and how collaborative practice makes for an optimal work environment. I look forward to my future in nursing, improving my current skill set and harnessing new skills through this program to be all the best that I can be. Thank you.